Good evening, my dear doctors. I hope you're doing good. This is Dr. Azam here, your faculty of anatomy at PrepLadder, and I hope your exam was done today. Now, I hope you're feeling like completely relieved after the exam. By the way, how was the exam? Yes, I'm able to see all your responses over here. Hello, Dr. Himanshu. Yes, Jen, straddle injury was asked. Yes, of course. Yeah, it was like moderate to hard paper as I got the feedback from most of the students. या फेशियल नर्व पर दो क्वेश्चंस आए थे वेरी गुड केपी चौधरी फाइन ओके ओके जी चलिए ओके फाइन तो वट एवर द एग्जाम पेपर एग्जाम वॉज देयर इट वॉज एक्चुअली डन वट एवर फीडबैक आई गॉट फ्रॉम मोस्ट ऑफ द स्टूडेंट्स is that the paper was like moderate to tough because there was like a lot of integrated questions asked in this one and even the clinical one, the long questions and all. So from here, what is the take home point from here is that we should be ready from the next session. Whoever juniors are going to write down the exam, we should advise them that in the very beginning of the preparation, when they're starting in the very first couple of months or 3 months of the preparation, they have to concentrate mainly on the concepts rather than directly jumping onto the the shortcuts or just the rapid revision. Rapid revisions and all are just for the high yield topics which has to be done at the end. So you should actually revise all the concepts very well and integrate them very well. Okay. Yes, of course. Yeah. So chaliye sir, let's get started. Okay, fine. So first of all, let me give you the disclaimer here. These questions that whatever we are going to discuss in this PPT here are just like recall based, and the motive of this one is to actually get the questions that were asked in the exam. What are the topics asked in the exam? And the final questions whichever I'm going to receive and whatever feedbacks I'm going to take from you people in this session, I will be uploading the final questions and the final recall session on the PrepLadder app. Okay, so mainly this is like a discussion kind of thing. So wherever you find the language of the question a little bit different or the options to be like a little bit different, you can actually advise me. I'll make the required corrections in that one, and then we'll be actually uploading the actual session onto the PrepLadder app over there. Fine. Yes, fine. Okay, nine, no problem. Now let's get started with the very first question. Yes, of course, as we have predicted, in the 100 one-liner session that I have done on the PrepLadder YouTube channel, there I told you very well that from ulnar nerve, median nerve, and the radial nerve, the three slides that we are going to discuss, one question will be definitely coming from there. Okay, so let us discuss this one here, guys. A 45-year-old woman presented with a tingling sensation of the lateral three digits with the loss of sensation of the base of the thumb on the dorsal aspect of the hand. That is important. The loss of sensation onto the base of the thumb on the dorsal aspect of the hand. Which nerve will be involved? Can you please tell me what is the answer? Yes, my dear friends, I hope the right answer for this question here will be the radial nerve here. The right answer for this one should be the radial nerve. Why? Because we have learned that when you learn about the palmar surface, on the palmar surface, the medial 1.5 digit here, as well as on the dorsal surface, the medial 1.5 digit, the little finger and half of the ring finger will be supplied by ulnar nerve. Fine. And the lateral 3.5 digit here is supplied by median nerve. Fine. But on the dorsal aspect of the hand, remember, they have to give the word as distal phalanges. Distal phalanges here, they will be supplied by median nerve, or the skin covering the nail bed, that will be actually supplied by the median nerve. Okay, so therefore my dear friend, here it should be definitely which one here? It has to be the dorsum of the hand. That has to be your radial nerve. Radial nerve should be the answer in this one here. Sir, in the question it was written as tips of the digits also. Okay, fine. I'll just make a note of this one here. The tips of the digits. Fine. We'll make the required correction. Fine. So one of our friend is telling that yes, Vansh Rathod is telling that tips wala bhi tha. Okay, fine. So according to the recall that we have made over here, my dear friend, the dorsal aspect of the hand is involved and the base of the thumb is involved. Then it has to be the radial nerve. Radial nerve should be the answer. Yes, if tips of the digits were involved, I think that was a separate question. I got a feedback that there were two questions based on this one here. Yes. I think the tip of the digits were involved. That was given in the claw hand wala question. There was a question regarding the claw hand. Yes, exactly, Sharad Chaudhary. There are actually two different questions in this one. Yes. So there were two different questions in this one. One is about the dorsum of the hand, where the radial nerve is actually involved here. And about that, the person is not able to, make the claw hand here with the tips of those fingers involved. That was actually the ulnar nerve involved. Yes, yes. So that is a separate question, my dear friend. We got a clarity here. So यहाँ पर ulnar nerve involved होगा. यहाँ पर ulnar nerve involved होगा. Whatever from this discussion, from this healthy discussion here, we have come to a conclusion that yes, of course, my dear friends, all the students who are preparing for the further exams, so they have to learn about the ulnar nerve, median nerve, and the radial nerve. Always there'll be a question coming from there, and yes, we have discussed that very clearly. Okay, so two questions were asked here. One was about the claw hand, another one was about the loss of this one here. Fine. चलिए सर, अब हम आगे बढ़ते हैं. Let us go ahead with the next question. Which of the following is the afferent limb for the corneal reflex? So whenever you're having the corneal reflex or any reflex, for that reason, there will be an afferent and then there will be an efferent fiber for that one. Now, whenever you have this corneal reflex, the afferent, the sensory for our face, we know that very well. That will be by the trigeminal nerve. The answer for this one should be the trigeminal nerve. Fine. And whereas the corneal reflex, the efferent one will be actually the facial nerve here, sir. The facial nerve will be acting as an efferent fiber for this one, and afferent will be actually the trigeminal nerve. So this is the right one here. Fine. Yes, just someone you have given the right answer there. Absolutely true, guys. Next question here. Which type of the cartilage is present in the given histological section? If you people have seen my YouTube session on PrepLadder YouTube channel, my dear friends, at last or in the middle of that one, I told you very clearly that always there'll be like one question coming from either from epithelium or the cartilage. I told you there might be one question from the epithelium or the cartilage. I told you there. Fine. So yes. Now in the given section, you can clearly see here the chondrocytes, the cells present inside the cartilage here. The chondrocytes are actually arranged in groups here. So the chondrocytes will be actually arranged in the form of, groups over here in either hyaline cartilage or in elastic cartilage. Hyaline cartilage and elastic cartilage. They'll be arranged in the form of the groups here. Then after looking at the chondrocytes over here, then please look at the matrix here. The matrix there is actually appearing like, glass. It is appearing like a glass. Glass, hyalose. Hyalose, the word is coming from hyaline. The matrix is appearing like, transparent like a glass over there. So therefore, the answer for this question has to be like hyaline cartilage. Okay. Most of the students who have given the feedback, they were, yeah. Yes, of course, Prakhar Singh, Dr. Prakhar Singh, absolutely right. The matrix is actually like shiny like a glass. That is why it is like hyalose. Hyalose means appearing like a glass, hyaline cartilage. Most of the students who have given the feedback, they were telling it is elastic cartilage. Remember, my dear friends, in the elastic cartilage, in the matrix, chondrocytes will be arranged in the form of groups only, but in the matrix, the fibers should be like, visible over there. The fibers will be visible. Elastic fibers will be visible in that one. It is not like, slightly bluish tinge with the glass-like appearance. ऐसा नहीं होता है elastic cartilage में. Clear with this one? So it has to be the hyaline cartilage. So fine. Dr. Kunika Gupta is telling, but the image was different. This is actually the image that I got from some of the students. Yes, Dr. Gupta, if you have the right image with you, if you can search on Google and send it to me, please drop me a message on that one. We'll make the corrections required. Okay, fine. Next one. Whatever, you got the concept very clearly here. I hope, yes, of course, Dr. Dhayan. I hope you got the concept here right. Next one. Identify the structure marked X in the given image below. Now in the given image below, actually there is a tonsil there, and we are actually speaking about the tonsillar bed of the tonsil. Now we have actually discussed in the rapid revision session about the tonsillar bed, Now in this diagram, you can clearly see very quickly here. So first of all, you'll be having the tonsil here. Then this will be actually the paratonsillar vein. I'm telling you the structures that you have to remember. So there will be a paratonsillar vein, and then the next fascia here will be the pharyngobasilar fascia. And then you'll be having your superior constrictor muscle, and then that will be covered by buccopharyngeal fascia. So that is a sequence of the structures present in the bed of the tonsil over there. And yes, in our exam today, in FMG exam today, they have marked this fascia here. So this fascia here was marked, and that is actually the pharyngobasilar fascia. Pharyngobasilar fascia. I hope you have marked this answer over there. Fine. Yes, of course, we have discussed about the cartilage. We have discussed about the cartilage. If you have the right picture, you just drop me a message about the right picture. I'll be waiting for the right picture there. Fine, no problem. After that, as I told you in the very beginning, after all these modifications, after our discussion here, we'll upload the final session onto the PrepLadder app. Don't worry about that one. Okay, good. Thank you, Rasik Khadri. Thank you for the anatomy part. Next one, sir. Now identify the defect in the given image. I hope you are able to recall my words. If you have actually heard my session, if you have attended my session, you're able to recall my words. I was telling you there will be a definite one question from the neural tube defects. There will be one question definitely coming from the neural tube defects करके मैंने आपको बताया था, है ना? So now this is the open neural tube defect or the meningocephalocele occult spina bifida occulta or encephalocele. See, now my dear friends here, the moment you look at the options here, might be the moment you look at the picture there, you might be finding it like, okay, there was rachis and you are suddenly trying to find out where is rachis in the options given there. The rachis is not given there, but you can easily eliminate the options there, my dear friends. It can't be, it is not at all meningoencephalocele, it can't be spina bifida occulta, it's not encephalocele, it's an open neural tube defect, definitely. It's an open neural tube defect over there. Understanding, my dear friends? So I told you that one question will be definitely coming from the neural tube defect. Yes, there was a question about this one. Thank God, whatever hard work that we have done, it paid off. Okay. I think now the students who are telling like, anatomy questions were little tough in the exam, they're getting the realization after question by question that, okay, हमने कहीं ना कहीं तो ये पढ़ा था, है ना? हाँ, एग्जाम देने के बाद में एक्चुअली ऐसा ना मिक्स्ड ओपिनियंस होते हैं. So it will take like 24 to 48 hours of time to get a proper idea about all the subjects and all. So let's just try to get all the questions right here. Okay. Chaliye. Now let us go ahead with the next question, my dear friends. Try to read these questions and try to solve here. A young male presented with the weakness of lower half of the right half of the face. Lower half of the right side of the face with the dropping of angle of the mouth. I hope you're able to recall. We studied about the UMN and LMN lesion of facial nerve. अपर मोटार न्यूरॉन एंड लोअर मोटार न्यूरॉन लेशन ऑफ द फेशियल नर्व हमने पढ़ रखा है. तो मैंने आपको कहा था लोअर हाफ ऑफ द साइड ऑफ द राइट साइड ऑफ द फेस इज गॉन विद ड्रॉपिंग ऑफ द एंगल ऑफ द माउथ. दिस वर्ड्स विल बी गिवन टू यू. आई टोल्ड यू विद द ड्रिपिंग ऑफ saliva, with the dribbling of saliva. He is not able to rise his eyebrows also. He is not able to rise his eyebrows also. Eyebrows also are not able to rise. That means even this frontalis muscle here is also not working. Fine. And close the eyes on both sides. Which of the following is most appropriate diagnosis? Before I tell you the answer, can anyone answer me here, sir? Is it infranuclear facial palsy on the right side? Supranuclear facial palsy on the right side? Infranuclear facial palsy on the left side? Supranuclear facial palsy on the right side? I think, let me just correct here. Two times we have written the right side here. It should be like one time less left side. Okay. Now, first of all, tell me, is it like the lower motor neuron lesion or the upper motor neuron lesion? Thank you, Dr. Prakar Singh. Thank you. You just listened to the lecture just one day ago. Thank you. Yes, of course, my dear friends. Yes, of course. You can clearly see that the angle of the mouth is also actually dropping here, and then the person is not even able to move the raise the eyebrows over there. That means entire half of the face is gone. If the entire half of the face is gone, definitely it is your lower motor neuron lesion, LMN lesion. Okay, it is lower motor neuron lesion. So therefore, we are going to rule out these two options here. These two options we are going to rule out here, sir. है ना? And lower motor neuron lesion always it will be actually ipsilateral side only. So अगर वो उसने यहाँ पर बताया आपको, there is an indication given here as right side over here. So it should definitely which one here? The infranuclear palsy on the right side. Are you getting my point here, my dear friends? Are you getting the clarity here? So the angle of the mouth, dropping of the angle of the mouth, fine, that is also there. And the person is not able to raise the eyebrows also. That means complete half of the face is gone. That means it is actually the lower motor neuron lesion. And that is nothing but the infranuclear facial palsy on the right side. And lower motor neuron lesion always it will be like ipsilateral side only, on the ipsilateral side only. Okay, now I hope everyone got this answer right. Yes, many of them has given this feedback here based on this like facial nerve. They were like questions asked about the upper motor neuron and lower motor neuron relation palsy also. So I'm happy that we have actually discussed that just before the exams. ठीक है ना? Eyebrows were spade दिया गया था. Okay, I'll just write a note here. Okay, eyebrows were spared. Eyebrows were spared करके मैं यहाँ पर लिख लूँगा. Okay, fine. Okay, fine. Dhoni. Eyebrows was not included. Okay, fine. Acha, okay, fine. If the eyebrows are not included, yes, my dear friends, if the eyebrows is not included, then common sense that only the lower half of the face is actually involved there. Then it should be actually the supranuclear facial palsy of the left side then. Supranuclear facial palsy on the left side then. Okay. चलिए मैं आपको ना ये कॉन्सेप्ट कंप्लीटली क्लियर कर देता हूँ. I'll just clarify this concept here. Hello, my dear friends. Hello, my dear friends. We know the concept very clearly. If complete half of the face is gone here, then obviously it will be the lower motor neuron lesion, ipsilateral side, same side. Then suppose some of our friends are telling that, okay, now let me use another color for this one here. Some of our friends are telling that yes, this eyebrows were spared दिया गया था, ये included नहीं था उसमें. Then obviously then your answer has to be like this one here. Which one? The supranuclear facial palsy on the left side होना चाहिए क्योंकि upper motor neuron lesion contralateral होता है. ठीक है ना? I hope those two things are very much clear. Perfect. Is it okay? I hope you got the answer very clearly. चलिए next one sir. Identify the defect in the given image. Come on, can you please tell me? Okay, Dhoni, exactly sir. Thank you Dr. Dhoni. Let's go ahead. Yes, it was not involved. Okay, I'll make the required corrections and we'll upload the exact thing onto the PrepLadder app. Don't worry about that. Chaliye sir. Yes, identify the defect in the given image. Is it like Erb's palsy, the congenital hypoplasia of orbicularis oculi, infranuclear facial palsy of the left side, or supranuclear palsy? Yes. Yes, my dear doctors, can you please tell me here? Now, in this diagram, you can clearly see here, yes, first of all, the lower half of the face is actually involved here. Eyes were closed in this and forehead was also involved. Oh my God. Now there is a lot of confusion between the feedbacks that we are getting from many students here, है ना? Yes. तो अगर ये वाला involved है and even eyes were closed as well as the forehead was also involved, that means you are speaking about the complete half of the face again. Yes, Dr. Singh, Dr. Sudhanva Singh. Eyes closed थी sir. Okay, fine. Oh my God. That means this exact picture was not given in the exam. Just let me get the clarity on this one here. Okay, Dr. Shraddha Narode is telling that yes, complete half of the face is involved. Okay. Then if the complete half of the face is involved, then obviously it will be like, the lower motor neuron lesion then. No image was different. Okay. So do one thing here, just send me the right image here. Okay, now we want the right image here. Image is not this one here. The eyes was also closed. Bell's palsy was also there in the option here. Bell's palsy. Okay, fine. Option had facial nerve and third nerve. Oh my God. Oh my God. मतलब ये हमको completely इस क्वेश्चन को मॉडिफाई करना पड़ेगा. You have to modify this question completely, right? Fine. Okay, fine. I'll take care about this one. Dr. Wahib, seventh nerve palsy. Okay, fine. Oh my God. Now Dr. Ritu Bandari is telling that no Bell's palsy, it was written by infranuclear palsy of the facial nerve. Okay, ji. Infranuclear palsy of the facial nerve. We are getting options after the options here right now. So we'll do one thing, we'll just keep this question aside. I have got like all your feedbacks there. And if anyone can help me with the exact image of this one, please help me with that one. And then we'll come back with the right answer. Fine. But overall, my dear friends, the best thing, the good thing, what I'm observing here in the chat box here is that you people are able to answer the like the concept very clearly. You know the concept very clearly. ठीक है ना? एग्जामिनर ने आपकी बार ऑप्शंस में बहुत दिमाग लगाया है, बहुत क्लोज ऑप्शन थे. Okay. No Bell's palsy was there. Okay, fine. I'll just strike it off. Fine. You just let me know the right things over there. We'll modify the entire question there. Fine. You just send me the right image. Identify the marked area in the given image over here. Is it Morrison's pouch? Is it vesicouterine pouch? or the pouch of Douglas or ischioanal fossa. Now in this diagram, I think this is very much simple here. This one here is the rectum here, and then this one here will be the uterus, a recto-uterine pouch, and that is actually the pouch of Douglas. This is nothing but the pouch of Douglas. Fine. Absolutely. This is like a simple question over here. We know that very well. Now identify the lymphatic structure from the histological section given below. In this lymphatic section, it's straightforward. It's a simple one over here. We have discussed in the histology images that we have given in the, rapid revision session over there. This is actually the structure of thymus. I hope you had the thymus. Fine. Sir, the image was given of the male pelvis. Achhi baat hai, sir. The image was given of the male pelvis over here. Fine. Not the female one. Fine. Chaliye, sir. Next one. Now the histological section in the given image below. Identify the marked cells here. Hello, my dear friends. I think this was like a time-saving question for you. You know, the moment you saw this, I even told you the question also that always nowadays they're giving cerebellar cortex histological image, and in the cerebellar cortex the cells that you're able to identify, the largest cell and the flask shaped cells, this will be the Purkinje cells over here, sir. तो ये आप आइडेंटिफाई कर सकते हो इजीली, ये Purkinje cell. Fine, fine, fine. I'll actually change that image there. We'll change that to the male वाला image. Fine. Okay जी, ठीक है. And ischioanal fossa was not there in the option. Fine. Yes, Dr. Sudhanva Singh is absolutely correct. I remember your line that कुछ पूछ सकता है slide में तो Purkinje cell पूछ सकता है. Yes जी. So this was given and that was like Purkinje cell. Fine. Next one. So this I hope this question was correct over there. This image and everything was correct over there, and they have asked about the Purkinje cells over there, sir. है ना? And one more question, like the options of that which have not included here is, yes, they have given about the blood at the meatus, and then there was like a question about the straddle injury. If you people remember, you can send me the right question and the options over there. And yes, in pelvis and perineum, I'm telling you repeatedly that always they're asking one question about the extravasation of urine. Extravasation of urine वाला यहाँ पर से सवाल पूछा जा रहा है. तो please remember, whenever there is a straddle injury here, yes, the urethra will be, that will be ruptured, will be the bulbar urethra. In straddle injury, the urethra that will be ruptured will be the bulbar urethra. Riding a bicycle on the bumpy road, yes, bulbar urethra will be ruptured, and we have learned about the extravasation of urine into different places over there. ठीक है ना? चलिए. It was a feeling when I saw the Purkinje cell, I did not even read and saw the other options. That's really nice, doc. Fine. Manhole straddle injury, hematuria, the site of urethral injury. Yes, absolutely correct. If it is like straddle injury, no doubt about that, it will be bulbar urethra that will be involved there, sir. So there was one question on epiphysis. Okay, fine. So there was a question on the epiphysis. Fine, my dear friend. And the question was, the point was towards the styloid process of the ulnar bone, pressure epiphysis or the atavistic epiphysis. See, I'll tell you one thing here. Epiphysis is nothing but the end of the bone, है ना? The ends of the bones are epiphysis here. Actually, you can just answer that very easily, my dear friend. I'll tell you the hint here. अगर वो articular है, मतलब the end of the bone which is involved in the joint, if it is articular, then it will be referred to as a pressure epiphysis. It will be pressure epiphysis. If it is non-articular, अगर वो joint में involved नहीं हो रहा है, then obviously it has to be the traction epiphysis. It is formed by traction of the muscles. Fine. It will be traction epiphysis. So if it is involved in the joint, then after that, my dear friends, yes, who has recalled this question? Yes, Dr. Sachin Goyal. After this, if you know this hint now, if you know this basics clearly, after that, no need to mug up the examples over there. Now, if I tell you about the head of the humerus, the head of the humerus will be involved in joint, and that will be like articular, so therefore it will be like pressure epiphysis. Why? Because it is weight bearing, it is bearing the pressure. अगर मान लो मैंने आपको बोला tubercle of this one, greater tubercle or the lesser tubercle, whatever, तो greater tubercle मैंने अगर आपको बताया, तो it is not involved in the joint there, it is formed by the traction of the muscles over there, that is traction epiphysis. So दोनों भी ends में ही हैं, both of them are in the ends of the bone only. Head will be involved in the joint, so therefore that is articular, therefore it is pressure epiphysis, and whereas tubercles, trochanter and all those are not involved in the joint, so they will be like traction epiphysis, guys. Okay, no? Parkinje wala question was great. Thank you. Okay, 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 fine. Craniorachitis wala picture was given. Fine, 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 fine. Pressure epiphysis was given. Fine. So yes, we got the options. We got one more question over here, that there was a question regarding the epiphysis also. That is well and good, my dear friend. Okay. Okay, the picture was of the tibio-talar or fibular joint. Fine, no problem. Got it, sir. Yes, Dr. Sachin, thank you. Thank you for that question. I really appreciate that. Because that question, no one said that one. You are the only person who has given the feedback regarding this one. Thank you. Straddle, straddle की spelling गलत थी. Fine, fine. Male pelvis. I have taken a note of that one, Dr. King. I'll make the required changes in this one. Fine. And these were the questions over there, my dear friends. Yeah, yeah. There was a question about the Callet's triangle also. They have asked about the artery. There was a arrow mark on the artery there. Okay. Yes, there was a yes, hepatic artery was marked over there. The right hepatic artery was marked in that one. नो 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 कैलेट्स ट्रायंगल के पास पास में तो राइट हेपेटिक आर्टरी आएगा ना. या कैलेट्स ट्रायंगल के पास में तो आपको राइट हेपेटिक आर्टरी आएगा. फर्स्ट ऑफ ऑल यू विल बी हैविंग द कॉमन हेपेटिक आर्टरी. देन यू माइट बी सीइंग द पिक्चर लाइक दिस. द राइट एंड द लेफ्ट विल बी देयर एंड द राइट विल बी प्रोवाइडिंग वन मोर ब्रांच टू द gall bladder. Gall bladder, that is a cystic artery. Yeah, right hepatic artery, and most commonly it will be giving the cystic artery there. Yes, Dr. Sudhava, if you count the questions right now, अगर आप यहाँ से questions count करोगे, we got almost like exactly 17 questions from anatomy. We got 17 questions from anatomy. Yeah. You can count the questions that we have discussed over here. Yes, almost like 17 questions has been asked from the anatomy part there. Apart from that, there was a question about the, yes, one more is about the Meckel's diverticulum also. So all these questions I'll be including. Meckel's diverticulum भी हमने डिस्कस किया था इन द 101 लाइनर सेशन में. मैंने आपको बताया था वाइटलो इंटेस्टाइनल डक्ट का जो प्रॉक्सिमल पार्ट होता है, Meckel's diverticulum. There was an image based question given on that one here also. Fine. Yes, yes, yes. Yes, Prakash Singh. So, my dear friends, by this we have discussed all the questions from anatomy, and thank God, thank God. Yes, they have asked the questions that we have actually discussed over there. Almost like 17 questions has been asked till now. And later on, yes, as our friends are trying to recall, as I told you, it will take like 24 to 48 hours to get the exact recall. Like slowly all the students will be recalling. So we'll gather all the questions and we'll do a proper session next time. And thank you for the discussion. I hope you now got an idea about this one here. Bogdalag hernia was also there, it seems. Like some student is answering over there. Embryo after the 7 days. Okay, I'm just trying to make a note of this one here. I'll come back to this one. Take it. Embryo at the 7 days. Fine. So hope, my dear friends, you have written the exam very well. That was about the anatomy session. Like, thank God the expected questions has been asked in that one. You're able to answer that one, my dear friends. God bless you all. Relax now for some few days, because this is the like the golden time that you have right now after the exam and before the result. So until unless your result comes, you enjoy your life over there, because once you get the result, again starts a new chapter of your life. I'm praying here, inshallah, you'll clear your exam. And after the result, again, the next chapter is about the internship and all those things will happen there. So just relax and enjoy your life for a few days. Okay. So that's all about the recall questions of anatomy right now. I hope you've answered it very well. All the best. Thank you. God bless you with lots and lots and lots of success in your life, in your future endeavors. Thank you all.